Okay, good evening all. Can you hear me? Good evening, Asha. Can you guys hear me? Good evening, Bina. That's great. Let's just wait for 5 more minutes and we will start. Okay. Okay, great. Let's start. So, hello everybody. Welcome to Speaking Headers. We missed two live sessions the previous 2 weeks, but we are back. And today we're going to discuss about a speaking topic: swollen face. The patient came to emergency department, and we will see the details during this next half an hour. But before that, this topic was a task on March 6th exam. And thanks to those who wrote the exam on March 6th, they told me about some, not the exact part, but I asked to around like 15 to 20 students, those who wrote the exam, and they gave me some clues about what was the task, and that's how we made this task, and I believe it was almost the same, because some of them told me that the patient came to the clinic, sorry, to the emergency department first time, or some said that the patient has been already assessed. So I took for the majority, and the majority told me that the patient has been already assessed, assessment completed, examination completed, and the nurse is about to provide some details and collect some history about what happened. uh, let's move on, and before that I would like to share some happy news with you guys that our third batch wrote the exam on, if I'm, yes, March 6th, yes, March 6th batch, and we have 90% success again, and no one failed in speaking. That's a good thing, and our regular students already know about it. The first two batch we had 100% success. When I say 100% success, it was the first batch was only two students, and both of them scored all B in all modules. Then the second batch, four of them wrote on January 23rd, and we had all four of them got the record score. It was not all B, but still they got their some of them processing for UK, some were processing for Ireland, and some got all B. And our third batch, which the result came like a few days ago, 2 days ago, and it was also some good results. Some were migrating to New Zealand, so glad to see that most of them scored speaking about 350. That was a good achievement, and once again, thank you, students. Thank you for your hard work and everything. Without you guys, we cannot move forward. And thank you for all the support. And we do have a good number of batch who are writing the exam on April 10. We have 8 of our students who are going to write, and I'm sure they will all achieve their dreams, and I wish them all the best. So without further ado, let's move to the task. So like I said, today's task is swollen face, inspired by the official task of March 6th exam. It was about swollen face allergic reaction, and the topic we got it from the students who wrote the exam. And thank you once again for all those who wrote the exam and provided me the details to make a question for you guys. So once again, we are speaking headers. Please subscribe our channel, and myself Ringu Johnny. Okay, let's look at the setting. Setting is here emergency department, and here is the nurse topic. A 60-year-old patient who has come to ED, ED means emergency department, with a swollen face, which he thinks due to his gardening yesterday. You have completed the examination of the patient, and the patient appears to be anxious. Again, let me just remind you guys, I'm going to speak in English, mostly in English, but I'll try to speak in Malayalam in between for the Malayalam audience also, because let's just everyone gets the knowledge, because some need some explanation in Malayalam also, that's why. But mostly we'll try to speak in English only. So here the task says, I'm not sure in the exam it was 60-year-old, but this was most of them told me that it was 60-year-old. That doesn't matter. The age is not a factor here. Here is the task is the most important part. So a 60-year-old patient came to trauma emergency with a swollen face, and he doubts himself it occurred or it happened due to his gardening activity. He was involved in gardening yesterday, and when he waked up this morning, he found that his face is swollen. And as a nurse, you have already completed the examination of the patient, and at the same time you see that the patient appears to be anxious. അതായത് ഈ പേഷ്യന്റ് എന്ന് പറയുന്ന ഒരു 60 വയസ്സുള്ള ഒരു പേഷ്യന്റ് ആണ്, സോളൻ ഫേസുമായിട്ടാണ് എമർജൻസി ഡിപ്പാർട്ട്മെന്റിൽ വന്നിരിക്കുന്നത്. അയാൾ സംശയിക്കുന്ന വെച്ചാൽ ഇന്നലെ അയാൾ ഒരു ഗാർഡനിങ് ആക്ടിവിറ്റിയിൽ ഇൻവോൾവ് ചെയ്തിരുന്നു. അപ്പോൾ ആ ആക്ടിവിറ്റിയുടെ ഇടയ്ക്ക് എന്തെങ്കിലും സംഭവിച്ചതാണോ എന്നൊരു ഡൗട്ട് അയാൾക്കുണ്ട്, വിച്ച് ഹി തിങ്സ്, not sure, 100% sure. And for your information, you have already completed the examination. That means you examined the patient, and the patient at the same time the patient appears to be anxious. So let's begin the task. How about the introduction? Now, since the patient, we already know the patient, you can either start by greeting the patient. Let's imagine that it's a male patient and we can call him Joseph. So according to the time, always, as everyone knows, good morning, good evening, or good afternoon. Good afternoon, Mr. Joseph. My name is Ringu Johnny, one of the registered nurses working in this emergency department. Or you can say, good afternoon, Mr. Joseph. I'm the staff nurse on duty today in this emergency department. You can call me Rinku. Now, now you don't have to say here, please be seated, or you don't have to say how may I help you, all these things, because you already finished with your assessment. So how you go about it? So the first subtask is find out the reason for anxiousness and reassure. As we mentioned, the patient is anxious, so you need to find out what's the reason for anxiousness and you need to reassure. That means you need to support. So how do you do it? Like we said, we greeted already good morning or good afternoon, good evening, with the patient name, because we already know the patient, we already assessed the patient. And you can say, I'm the staff nurse on duty today in this emergency department. You can call me Rinku. Mr. Joseph, you look a bit anxious. Could you please tell me what's bothering you, or what makes you anxious? So he will say, nurse, as you know, I'm really worried about this swelling in my face, and I don't know what to do. I'm even worried about my future. Does it going to be remain there? All these things makes me anxious. Make me anxious. So that will be the reply of the patient. So in here you need to reassure him. How do you reassure? We can reassure in a lot of different ways. So I will provide you a few examples. So normally we all say, I completely understand your concern, but no worries, I can help you. These are the normal. But I will say what I mostly tell to my regular students and my students is that try to build more relationship by providing some extra examples, or you setting or providing some extra details in the reassurance. So you can say here by Mr. Joseph, no need to worry. I can reassure that you are in safe hands. So please relax yourself, and your condition can be cured if you follow all the instructions. So this can be one example. Or you can say, there is nothing to be alarmed about. Your condition can be treatable, and your condition can be treatable if you follow all the instructions whatever we are providing to you. So thereby you are assuring him that your condition is treatable, there is nothing to be panic about, or there is nothing to be worried, and it is a curable. It's not that it's not going to be lifelong. This can be easily manageable if you follow all the instructions, or if you follow whatever the prescription or the medication provided you by the doctor or the nurse. അതായത് നമുക്ക് പറയാം, ഇയാളോട് ഒന്നും പേടിക്കേണ്ട, നിങ്ങൾ സേഫ് ഹാൻഡ്സിലാണ്, അതുകൊണ്ട് റിലാക്സ് ചെയ്യുക, കാം ഡൗൺ ആവുക, പേടിക്കേണ്ട, നമ്മൾക്ക് ഈസി ആയിട്ട് മാനേജ് ചെയ്യാൻ പറ്റും. അതുപോലെ തന്നെ നിങ്ങളുടെ അസുഖം മാറുന്ന ഒരു അസുഖമാണ്. അതായത് ഇപ്പോൾ ഒരു ഡയബറ്റീസോ ഹൈപ്പർ ടെൻഷനോ പോലെ മാനേജബിൾ അല്ല, ഇത് ക്യൂറബിൾ ആണ്. അതുകൊണ്ട് റിലാക്സ് ചെയ്യുക, നമ്മൾ പറയുന്ന ഇൻസ്ട്രക്ഷൻസ് എല്ലാം ഫോളോ ചെയ്യുക. സോ ദ ഫസ്റ്റ് ടാസ്ക് ഈസ് find out the reason for anxiousness and reassure him. So you can reassure in different ways. So first example, I can reassure that you are in safe hands, so please relax yourself, and your condition can be cured if you follow all the instructions providing to you. Or you can say, I can reassure that you are in safe hands and we are a well trained team to equip any emergencies. Or there is nothing to be alarmed about, your condition can be treatable, or your condition can be you get a complete cure from your condition. So these are the ways you can reassure him. Now, since remember we already completed the examination, your second subtask is confirm the presence of swelling and ask for any associated symptoms. And they have given some examples like headache, skin irritation, rashes, breathing difficulty, nausea, and vomiting. So I'm not exactly sure these were the associated symptoms they provided, but these are the symptoms told by the students who appeared for the exam. So here you need to say, Mr. Joseph, I can confirm the presence of swelling on your face, and I would like to ask you a few questions regarding that. May I? Always make sure that you take the permission before you ask some history collection or ask some personal details. That's very important, and it's a basic manner to ask someone. അല്ലെ, അതായത് നമ്മൾ എന്ത് ചോദിക്കുന്നതിന് മുൻപ് ഒരു പെർമിഷൻ എടുക്കുക. അതായത് ഞാൻ ഇന്ന കാര്യങ്ങൾ ചോദിക്കാൻ പോവാണ്, അപ്പോൾ അതിന് ഞാൻ ചോദിച്ചോട്ടെ എന്നുള്ള ഒരു പെർമിഷൻ. So here in the second subtask, you're going to confirm. You're going to say him that, Mr. Joseph, I can confirm the presence of swelling on your face by my examination, and I would like to ask you some questions regarding your condition or regarding the associated symptoms. May I? So you will say definitely. So here one thing I want to remind you guys. Everyone is having a habit of repeating okay, okay, okay. So please be careful. Try to use some different words. We have a lot of words rather than using. Keep on repeating okay. If you record your own speaking, or if you listen, if you concentrate, or if you listen to what you're speaking, you can hear that at least minimum 5 to 10 times you're repeating the same word okay, okay, okay. So that's like some repetition. So try to use some different words like definitely, absolutely, of course, or if you're agreeing with the patient, you can say indeed, absolutely, all right, yes, that's right, without any doubt. So you can use different words. So now I say, may I? Definitely, nurse. That's the other part, that's the interlocutor part, definitely. So you can ask here, so do you have any associated symptoms along with your swelling, like any skin irritation, rashes, breathing difficulty, anything like that? So he will say yes or no. Here the task is no, there is nothing like that. Additionally, did you feel any headache, any nausea or vomiting? No, nurse, I don't have anything. The only thing I noticed is when I wake up this morning, my face is entirely swollen, and I believe it's because of my gardening activity. Oh, thank you for giving me that information, and I appreciate that. Um, Apart from this, I would like to ask you. So now here are the next your third subtask. Inquire about any previous illness or any previous illness, if he has, or any new medication. Did he started with any new medication or any allergy? Are you allergic to something? So you're going to go to the second level of history collection. Here you're going to ask about you're going to ask. So apart from this, I would like to ask you about some other details. Do you have any allergy? Do you have any allergy to any bee sting or any insect bites, or to any hay fever, or to any medication? So he will say yes or no. So in the task he says no, there is no allergies like that. So you can rule out that also. Then then the next thing you can ask, do you have any previous illness, or do you have any present medical history, or you want to provide, do you have anything like that, any hypertension, diabetes, or did you start with any new medications? So again in the task he says no, nurse, there is nothing like that. I'm absolutely fine and I remain healthy, thank god I'm remain healthy, there is no issues like that. So you can rule out that one. Then fourth subtask, you're going to ask him, inquire about any first aid you took, or any home treatment, or any we all have some, we always keep some medications at home. So did you tried anything, something like that? That's what you're going to ask here. So you're going to ask, did you tried any first aid or any home remedies, like any over the counter medication, or any creams or any tablets for your swelling? No, nurse, I directly came to the emergency department. So here another thing I would like to mention, a lot of them having a confusion when they say OTC. OTC means over the counter. That means the local pharmacy. That means, for example, if you need a paracetamol or a ibuprofen or some any tablets for any fever or something, or any what do you call, for any allergic tablets, all these things you can buy from the local pharmacy without any prescription. So the tablets which are available without any prescription, that's what we call the OTC counter, where you don't have to provide a prescription, you can easily get some medication by saying your condition. So you ask him again, did you tried any first aid, did you apply any cream or any over the counter medication for your swelling? Here also he says no, nurse. So after you hearing, so you ask three different set of questions. First thing, any associated symptoms. Secondly, you ask, do you have any previous illness, or do you have any allergies to any hay fever, bee sting or insect bites, anything like that, or to any medication? Did you started with any new medication this recently? Okay, so you ruled out all these things. And lastly, you asked, did you take any first aid, any homemade treatments, like any sorry, what was that? Any over the counter medications or any tablets, anything like that? So he refused that also. So now comes your fifth task. നമ്മളിത് അഞ്ചാമത്തെ ടാസ്ക് ചെയ്തു. അതായത് നമ്മുടെ ഒരു ബേസിക്കലി ഹിസ്റ്ററി കളക്ഷൻ കഴിഞ്ഞു. So you started with your introduction by greeting the patient with the name because you already know the patient as you completed the examination. Then you asked about his find out the reason for anxiousness and you reassured him. Then you confirmed the presence of swelling on his face and you collected some history like any associated symptoms, any what do you call, any previous illness, any recent medication started, any allergic reactions, anything like that? No, nothing. Is there any allergies? Nothing like that. Then the next thing you asked us, task number 4, you asked inquired about any first aid you took. So nothing like that. So you can say after you finish with that, you always make sure that you said thank you. So thank you for providing me the details and I appreciate that they are very valuable for our records. അല്ലെ, നമ്മളൊരു കാര്യം ചെയ്ത് കഴിഞ്ഞാൽ always say thank you for providing me the details and they are very valuable for our records. And you can say from the based on my examination and the history collected, I can say the possible reason for your swelling is due to allergic reaction. So now you saying it's not a confirmed diagnosis, you say the possible reason because he ruled out everything, that he doesn't had any associated symptoms, he doesn't had any allergies, or no he never started any recent medications, or neither he took any first aids. So now you're going to say that you're going to provide him a possible cause of swelling. So based on my examination and the history collected, I can say that your possible condition can be allergic reaction, and it may due to the plants or pollen, because the reason is he was gardening. Remember he said he already given the details that he was actively involved in gardening yesterday. So it can be because of because of some plants or some pollens. അതായത് ഇപ്പോൾ ഇവിടെ പുള്ളി നമ്മളൊരു അസ്യൂം ചെയ്തൊരു പറയുവാണ്, അതായത് ഇത്ര നേരം നിങ്ങളുടെ ഒരു അസസ്മെന്റും ഹിസ്റ്ററിയും കളക്ട് ചെയ്തതിന് ശേഷം അല്ലെങ്കിൽ എക്സാമിന് ശേഷം എനിക്ക് കൺക്ലൂഡ് ചെയ്യുന്ന ഒരു അസംഷൻ ആണ്, അതായത് എനിക്ക് കൺഫേം അല്ല പക്ഷെ എനിക്ക് തോന്നുന്നു നിങ്ങൾക്ക് അലർജിക് റിയാക്ഷൻ ആണെന്ന്. അത് എന്തുകൊണ്ടാണെന്ന് വെച്ചാൽ നിങ്ങൾ ഇന്നലെ ഗാർഡനിങ് ആക്ടിവിറ്റിയിൽ ഇൻവോൾവ് ആയിരുന്നു. ആ ആക്ടിവിറ്റിയിൽ മേ ബി നിങ്ങൾ അതിന്റെ ഇടയ്ക്ക് ചിലപ്പോൾ പ്ലാന്റ്സ്, ചെടികൾ അല്ലെങ്കിൽ പോളൻ എന്നൊക്കെ പറയുമ്പോൾ ഈ ചില ചെടികൾക്കൊക്കെ ഇങ്ങനെ പൂക്കളൊക്കെ പോലെ നിൽക്കും, അപ്പൊ അതിന്റെയൊക്കെ ഒരു അലർജിക് റിയാക്ഷൻ വരാൻ ചാൻസ് ഉണ്ട്. So it may be because of the possible it's maybe because of plants or pollen, and in your case I assume or possible cause of swelling is allergic reaction. Oh, okay, I understand, nurse. Thank you for that. But what must I do now? So now you're going to tell him that. That's right. Thank you, Mr. Joseph. But let me tell you, you need to wait to see a doctor in order to get a prescription or a proper examination. So now you're saying to the patient that the sixth subtask is you have completed the basic history collection and your assumption of diagnosis. Now you're asking him to wait to see for a doctor to get an examination or a treatment or medication. So you say, Mr. Joseph, thank you for allowing me to collect the history and everything. I would like to tell you that please wait to see a doctor for a proper examination and prescription or medication. And your doctor will be providing you medications for your recovery, like some antihistamine creams and some medications. So please wait yourself. Please wait here, and they will call you sooner. So now the patient says, no nurse, but I cannot wait. I have been waiting here for long. So please do something now, or when can I expect the doctor to see? So he will refuse it initially. So here comes your seventh subtask. Explain him that we cannot provide him a time period, or we cannot provide him a fixed time because this is an emergency department, and here the patients are seen on medical priority, not on first come basis, and again according to the availability of doctors. So he is refusing to wait, and he says he have been waiting here for long. So now you're telling him that sorry Mr. Joseph, unfortunately we not serving according to first come basis. Here we are seeing the patients on medical emergencies or medical priority. Maybe because some patients can be they're not in a severe or in a critical condition. Some will be having minor injuries. Some will have some just more observation. So we are seeing patients according to the priority, medical emergencies or medical priority. So please be patient and wait for your turn. And here again, we are according to the availability of doctors. അതായത് നമ്മൾ പറയുവാണ് പേഷ്യന്റ് അടുത്ത് അതായത് നിങ്ങൾ കുറച്ചു നേരം വെയിറ്റ് ചെയ്യേണ്ടി വരും. കാരണം നമ്മൾ എമർജൻസി ഡിപ്പാർട്ട്മെന്റിൽ ഫസ്റ്റ് കം ഫസ്റ്റ് അല്ല നമ്മൾ പേഷ്യൻസിനെ കാണുന്നത്, മെഡിക്കൽ പ്രയോറിറ്റി ആണ്. അതായത് ഏറ്റവും കൂടുതൽ സിക്ക് ആയിട്ട് ആരാണ് വരുന്നത് ഇപ്പൊ വന്നാൽ അവരെ ഇപ്പൊ തന്നെ ഡോക്ടേഴ്സ് നോക്കും, കാരണം അതാണ് അർജൻസി. നിങ്ങളുടെ കണ്ടീഷൻ കുറച്ച് സ്റ്റേബിൾ ആണ്, സോ കുറച്ച് ഒന്ന് വെയിറ്റ് ചെയ്യണം. ആൻഡ് അക്കോർഡിംഗ് ടു ദ അവൈലബിലിറ്റി ഓഫ് ദ ഡോക്ടേഴ്സ് വിൽ കം ആൻഡ് സീ. And you can say, according to my knowledge or according to my latest update, you will be called by a doctor anytime from now. So you can assure him that a doctor will come and see you anytime from now. That's how you end the task. So I will repeat again. Find out the reason for his anxiousness and reassure. Secondly, you confirm the presence of swelling and you ask him some extra details for any associated symptoms. Then you inquire about any previous illness or any allergies or any new medication started. After that, you ask for any first aid treatment you took or any home treatment or home remedies you took. Then the next thing, you inform him that the possible cause of reaction, possible cause of swelling is due to allergic reaction because of your gardening activity, maybe because of the plants and pollen. And the next thing, you ask him to wait to see a doctor for a proper examination and proper examination and prescription or medication like antihistamines or any tablets or any medications for your condition. But he refuses to wait. Then you say him that I completely understand your concern or I completely understand your situation, but do you know how emergency department works? We are working on medical priorities, not first comes first, and according to the availability of the doctor. So please wait here. And according to my latest update, you will be seen by a doctor anytime from now. Then you can say, being said that means after explaining all these things, you can say, being said that, do you have any concerns? No, nurse. Then thank you for listening me. I wish you a speedy recovery. You may wait here. A doctor will come and see you soon. So that's how you can end. So like I always say, you don't have to, or you can say, thank you for listening me. I wish you a speedy recovery. You may wait here. Meanwhile, if you need any assistance, please ring the bell. Remember, we are here to help you. So you can additionally put some extra support by saying, if you need any additional support or if you have any problems or anything, please ring this bell. We are here to help you. Remember, we are here to help you. So that's how you end a task. And this can be easily finished. Now, most of them worries is that how can I finish a subtask this long? But I can assure you that if you have a proper plan, do not go to the depths by explaining this and this, what is allergic reaction. So most of them have a habit of, when you, let's say the task number 5 is to inform about the possible cause of allergic reaction. So most of the students having a problem is that when you say allergic reaction, then now you go to explain what is allergic reaction. There you are wasting your time. No need. What is provided on your speaking card, speak accordingly, because I'm 100% sure that OET will always provide you a speaking task which can be speak only for 5 minutes. They won't give you a task for 10 minutes to speak. If you plan properly, you can complete a task in 5 minutes time. Like I think I had told many times, even when I attended the exam, there was about 8 to 9 subtasks. And it was about a vaccination, polysaccharide polycythemia vaccination. Even there was almost like 8 to 9 subtasks, but it was manageable. So plan accordingly. We can easily finish. So let me repeat again. You start by good morning, good afternoon, good evening with the situation. Then you can say by good afternoon, Mr. Joseph. My name is Ringu Joni, one of the registered nurses working in this emergency department, or you can say good afternoon. Good afternoon, Mr. Joseph. I'm the staff nurse on duty today in this emergency department. You can call me Rinku. Anyways, you can introduce. But I personally say to my regular students that try to introduce in two different ways, in two different role plays. This can provide you some extra scores and marks, and which we our students regularly gets that score. Even the last time our normal score was like 380. Most of them scored 380 in speaking, which is not easy actually. In fact, everyone knows. Then followed by you look bit anxious. Could you please tell me what makes you anxious? Then he will share his problem. Then after that, okay, based on my examination or based on the examination, I can confirm that you're having can confirm the presence of swelling, and I would like to ask you a few questions regarding. I would like to ask some questions regarding the associated symptoms. Do you have any rashes, skin irritation, headache, nausea, vomiting along associated with this? No, nurse, thank you. Then you can ask for any previous illnesses or any allergies you have to medications or to any any insect bite, bee stings, the normal allergies. Followed by, did you started any medication recently just to rule out any issue problems? That's it. Then you follow go to that any first aid treatment you took at home. No, no, that's perfectly fine. Then you can say your possible diagnosis. I can say that you I can let me say the possible reason for your swelling can be allergic reaction due to your gardening activity, and gardening activity maybe from pollen or plants. And I would like to tell you is that please wait to see a doctor, because a doctor will come and see you and assess you, and he will provide a medication or any prescription for your condition, like any antihistamines or any tablets or any creams. Followed by he refuses, so you can say when he refuses, you need to say you need to do not order to anyone, or do not never say I'm telling you to do this. Always recommend, try to recommend. So I strongly recommend you to be patient, and let me tell you that how emergency department works. We are working on medical priorities, not first come first. So please be patient and wait for your turn. A doctor will be coming to see you soon, according to my last update. And meanwhile, do you have any concerns? No, nurse. Thank you for listening me. I wish you a speedy recovery. Please wait here. Meanwhile, you may continue to take rest. If you need any help, please ring the bell. Remember, we are here to help you. So that's how you can wind up a beautiful task. And I hope everyone understand that one. And thank you guys. Thank you for joining. I don't think it was that long. And please continue to watch our channel and subscribe it. Another thing I would like to say is that I have updated a video for pursuing. I'm not sure how many of them done. See, there is a confusion for most of them, that about pursuing and recommending or advising or suggesting. Because whenever I speak to the regular batch students or to anyone, most of them say that I advise you to do this when the task says pursued the patient. So for everyone's attention, when we say pursued, it means to induce someone to do something by proper reasoning. That's the meaning. That's not advice. Advice is totally different. To induce someone to do something by proper reasoning. അതായത് നിങ്ങൾ കൃത്യമായിട്ടുള്ള ഒരു കാരണം പറഞ്ഞു കൊടുത്തുകൊണ്ട് ഇന്നത് ചെയ്യാൻ പറയുക. So you can say, if for example someone a patient admitted with the bronchitis, for example, and he's having a habit of smoking for last 35 years, and we want him to quit smoking, but he is not willing to do. So how do you pursue the patient? He doesn't want to do. So the task is pursued the patient. So you can say, I'm afraid to say this. That's how you need to say, I'm afraid to say this. If you did not follow the instructions provided by the doctor, you might have to face, or you might end up with what is it, lung diseases. So that's how you pursued. Or I'm afraid, if someone is refusing to do some exercises, I'm afraid to say this. If you did not walk every day, you will end up being obese. Or if you did not follow the medication compliance, you will end up being or your condition may end up being complicated. Or if you did not, I'm afraid to say this, if you did not do dialysis on a daily or on a regular basis, your condition may get complicated, or you will have bad effects on your health. So these are the ways you can pursue it. And I hope that's clear for everyone. Um, so please be careful when the task says pursued, or when it says so do not get confused with pursuing. So if you have any further doubts, you can find the video in our YouTube channel. For how to pursue a patient, we have provided 5 examples. Or when a bystander who is making difficult, or bystander who is making difficult to nurse the patient, or he's in the disturbing someone, so you can pursue. All these examples is been properly provided in the in our channel. So please subscribe and watch these videos. And there are also additionally we provided some videos for reassurance according to 12 situations, how you can like different role plays, how you can do different reassurances. So I always make sure to my regular batch students that try to watch that video, take notes, and start learning. That's the first homework I always ask them to do. And they always, I mean, and I do not expect a magic from day one. By 8 or 9 or day 8, 10, most of our students, they speak like, you know what, it's like a flowless, flowing river, they speak. And most of them, and you can even ask, there were students in the last batch who appeared the exam for fourth or fifth attempt, and they scored 360, 380 after achieving the previous scores like 300, 310 in speaking. So I do not saying that join here and study anywhere, but try to study accordingly or whatever. Remember again, it's not a simple test. You're paying a lot of money for this exam, so please do your hard work, and all the best to everyone, and please continue to support. And we will see you on next Saturday with another exam topic. I'm not sure which one, but it might be the recent exam topic. There was a same task for dog bite with the health education, so maybe we'll coming back with that one. Or there was a task for smoking, so let's see how we can do that. And we will be coming with another video for how to do writing actually, and reading tips. Writing, I just want to discuss how to plan a writing task, because most of them say they forgot to write this, they forgot to do this. So we'll be coming with a video very soon for how to plan, how to number your data, how to take the relevancy, all these things. And I hope this section was very useful for everyone. And thank you guys for joining. If you have any doubts, you can put in the in the chat. I can come to you. I'll be continue to be live on for the next 10 minutes. You can please put the message. I'll wait for everyone. If you do not have any doubts or anything, thank you for joining. And thank you guys once again. Thank you for everyone. Thank you. Starting from here, there is a lot of Asha, Beena, Vilma, Ashudish, Sibi, Bindu, Ramesh, Manchu, Anju, Jeena, Simi, Kochu, Anna, Grishma, Nimisha, Shoni, Dhanasri, Neetu, Sujata, Mini, again another Asha. So thank you guys for joining. If you have any doubts, you can send me the WhatsApp, or you can just put in the chat group. We will discuss in the next 10 minutes time. Then we will wind up the section. Anyone want to ask me anything? Any doubts? Hi Simi, we'll discuss one very. We're going to plan one. Hi Sudha. Anyone want to ask anything? Any doubts? Please provide more tips also in next video, Grishma. Sure, we will. What we'll plan is we will do a speaking task. Then I will provide some extra tips for writing and speaking and reading videos. The only suggestion I want to give you when it comes to writing, wherever you are studying, try to stick to that formula. Do not look around for 100 videos and try to not get confused with the different ideas. Then end up with a mixed masala, it's not going to help you. So stick to wherever you are studying and keep practicing that way, because otherwise you will get confused, because if you watch 10 YouTube videos and if you watch 10 different corrections, you will try to put everything in one letter and it won't be that helpful. So please be careful with that things, because I'm not refusing to I'm not saying that you mustn't watch, but I'm saying it can cause more further confusion. But if you find some listening, reading good videos, watch, because you might get some extra tips. But again, I would like to say that I can 100% I can assure you that whatever the tips you getting from YouTube or from anyone for listening and reading, at the end of the day, if you practice only, you can work it out. You need to find out a way. Again, even including me, if I provide you a tip to how to do reading tips, yes, there is a tip, but at the end of the day, if you can able to practice it, or if you can able to do that way, then only you can manage. So I personally say, try to find out a method for you which is suitable. And the way I was practicing, I discussed before, that I was reading for 3 minutes exactly for part A in reading. Then I was marking what was relevant for me. No one can teach you how what is relevant and what is irrelevant. That you need to think which is relevant and which is irrelevant. Then mark accordingly and go for it. Jitendra, I find listening and reading quite difficult. I don't know why. See, everyone having their own difficulties, even me, including me, because I shared before that when I started to study, I was scoring, this is true actually, I was scoring 6 out of 42 in reading, and let's say like 8 or 9 in listening. And I given up studying OET like twice or three times. I even thrown away my books. But there was a will that, I mean, like we say, we had a will that I want to do this. So that's what guided me. I want to do this because look, I always say to everyone, wherever you are or whatever you are doing now, you are not happy with that, or you want a progress in your life, or you want to take your family to the next level. So that's the reason we are doing this exam, right? And when you compare with IELTS, this is easy. This is easy in a sense, but here also you need to do a lot of hard work. I'm talking about when you compare with IELTS, or it is easier to do. So again, you need to put your hard work. um, that's the only thing, because no one can give you no one can tell you you can I mean, no one can give you a full idea that you can do this listening or reading like this. A lot of them are saying, you pay me this 4,000 rupees or 2,500 or 2,000 rupees, I can give you provide ideas for reading. It's not going to work, I'm sure, 100%. At the end of the day, your hard work. I would like to say another thing. A lot of students who are coming to me saying that I paid to someone, let's say like 10,000 rupees for my classes, and after one or two classes, I was not happy. I do not want to continue there. So my only recommendation, there are a lot of institutes in Kerala or anywhere where you don't have to pay in advance. After take a demo section first from anyone, tell them provide me a demo section, and if you're happy, then I will pay you. That's the way you need to do. Do not pay in advance and then say I was not happy. The explanation was not good. That's not their fault. It's your fault, because the money it's a hard earned one. So please make sure that you when you pay to someone, make sure that you're getting that, you get the quality. Okay, let me see. Jitendra, listening and reading, when it comes to listening, again, it's the how do you say, it's identifying the keywords. For example, when it comes to part B, It says, let's say, uh, Mr. Manoj, uh, or say, Manoj is waiting in the emergency department, or Manoj is waiting in the library, for example. He's waiting in the library. Uh, oh, that's what the stage says, and the sentence says, and it says, what does he's doing at this stage? So it means what does, what is he doing? It says he is listening to music, he's reading a novel, or he's playing games. So it says what does. That means what is he doing? What is the keyword? What is he doing? So look that what, and according to that find the relevancy. The relevancy says is reading, listening, or playing, right? So you need to underline that reading, listening, and playing. And when the audio comes, the audio will be saying he was not listening to music. But immediately what we do, when you heard only listening, then you mark. So we need to be very vigilant and very careful when it's saying. Or maybe they will firstly say, he was listening to music, but he didn't find it interesting, so he was playing games. So when you heard it first, it was saying he was listening to music, but you didn't hear that. You immediately mark the answer, but it says in fact he was playing the game. So that's the problem most of them having listening skill. For that purpose, what I did was try to download videos from YouTube, make into audio form the podcast, or to anything, make it to the audio form. And while if you are doing some activities, or if you are cooking for someone who is cooking, just keep the audio on and listen to what they say. Or when you go for walking, I don't think everyone is going for walking, but or when you do something, listen to that what it's saying. It's not, I can, it's not that 100% you are getting it, but something you will catch in that. So try to listen to the podcast. Reading habits can help you to an extent. If you have a good reading habit, definitely it can help. Then says, see, Grishma says, while writing introduction, please provide further care from your facility. Whether this is wrong if you write from your facility or at your facility. According to me, from your facility, at your facility, these were we were writing in OET 1.0. I always recommend all my students or those who are approaching me, if you have any doubts, message directly to OET. They will come back to you. Go to your Facebook Messenger, type your question. They will come back to you in 24 hours time, or they will give you a solution for that. Because I do not see anywhere in recently it's saying from your service or at your service, anything like that. It was in OIT 10. According to my knowledge, I'm not sure. I cannot assure you 100%. But according, I never ask my students to who are studying with me to write this at your service and from your service. Mostly, I tell them to not to write like that. I will say that, for example, we can say, Mr. Egg, I'm writing regarding, that's the most preferred for me. I'm writing regarding Mr. X, who is recovering from a lung resection. He requires, he requires continued care and management. That's fine. Or what is the purpose saying? Or he requires living arrangements following her discharge today, whatever it may be. So that's how I tell the students. Another thing I noticed that most of them have a habit of writing three sentences in introduction. Stop practicing like that. Try to keep in two sentences. OET strictly says. And listen to OET live sections, especially from Rebecca ma'am. If you have any queries or any doubts, you can ask her. She will definitely come back to you in that live section. If you find that what, even including me, if I'm teaching, if you feel that that is wrong, go to the live sections, ask the doubts. That's what I was doing while I was practicing. Or send a message to officials. They will come back to you definitely. Look at the samples in the official oet.com. You will find a you can find the ways how they are writing. I never seen in their letters at your service, from your service. These are the ways to make it easy for us. Someone did like this. I'm still saying that you will get the score, maybe, may not be, I'm not sure. But it's better to avoid like that. And do not repeat the data. Do not write above mentioned. Do not write as, sin, or besides, all these words above mentioned. And recently, OET said that, it's not recently, it's been few months, that you cannot expect dual cases, like cases of, like we have seen examples for Rohan and some Ron and Rohan. So two dual cases you cannot expect. You cannot expect on the behalf letters. So if you are studying in any institutes, they are still giving you tasks for on the behalf letters and letters for dual cases. You cannot expect. You cannot expect this type of letters in OET anymore. That's what OET officially says. If you need a proof, I can give you the proof that when I asked them, they gave me, send me the messages like that, and I have shared with my students about that. This is the only platform I can share about that. Then another thing, but still you can expect letters for a mother and a child. You can expect them, but the main will be one person, either the mother or the child. So if the letter says about a mother and child, you can still continue to write the introduction only about the mother. Or if it is about the child, during the body paragraph you can slightly mention about what is required of the child or the mother. That's fine, but not on the introductions. You don't have, you cannot expect anymore on the behalf of this, or on, I'm writing on behalf of Mr. X. No more, no more like that letters. Then another thing, when it comes to writing, I would like to say that when you write a letter to a social worker, dietitian, or a physiotherapist, you don't have to mention the medication names and everything. That's my way of writing, because try to make it simple by you know he has hypertension. He has hypertension, comma, managed with the appropriate medications. That's what I normally say that. And our students, so far, I think I cannot say that 100%, because the first batch, both of them got B in writing. The second batch, four of them got, four out of four of them got, because I do not take a huge number. The maximum I took is like 25 students at a time, but we provide according to that time. We schedule accordingly every week for the classes, so that everyone gets proper attention. Because basically it's not a, what do we say, not a proper business, because we are running like we all are working, and when we have the sharing, I mean, remaining leisure time, only we are taking the classes. So yes, again, yeah, again, another thing, when you write a letter to a social worker or to someone like that, you don't have to explain in detail about the what happened in the hospital. Make it simple in a simple one paragraph. Always start with, when you write a letter to a social worker, with the social history first. Um, okay, Grishma, I hope that's clear for you. Lino, can you please tell the order of your writing letter? Yes. Always make sure that if you're writing a letter to writing a urgent letter, always make sure that you start with your body paragraph with the today what happened. Today what happened. For example, there is a letter for Patricia Stiles, where during the home visit she was found to be unconscious or something like, I don't exactly remember. So you start with what happened today, followed by the initial history and the social history. So that's how you can start with the, when you write a normal referral letter or something, you can start with the primary complaint, presenting complaint. Then you can go to the past history and the social history and the discharge advice for paragraphs. Um, Another thing, when you write a social letter, social history first, then the presenting complaint, what, or during hospitalization, what happened, then the past and the concluding histories, concluding paragraph. Make sure that when you write a letter to a physio or a dietitian or a social worker, do not write, if it says organize a visit to the doctor on weekly basis, do not bring it in the concluding paragraph, because a social worker is not going to do it most of the things. So maybe it says arranged. So be careful, what is required, what you expect from the social worker to do, only write that in the conclusion. Do not repeat the data. Let's say like It's like, for example, it says physiotherapist. It says a rehabilitative section. So you're writing the introduction that um, he requires rehabilitative. He requires rehabilitative sessions. Rehabilitative can be rehab, or he requires rehabilitative sessions for his left elbow. It can be something. So when you conclude, you can say, I believe Mr. X would benefit from your sessions to regain his mobility of regain full mobility of his elbow. That's all. So try to write in different ways, or do not continue with that cliches of it would be greatly appreciated. Still, you can get the score. But or you can say when you write the emergencies, you can write your prompt intervention in Mr. X condition would be greatly appreciated if you do not have anything to write for the conclusion. And while writing letter, if 180 200 words is not obtained, what we can do? See, most of the case notes, when they give you for the exam, it can be the data is given for you to write to 180 to 200 words. But I will say that uh, I am sure that everyone's seen the OIT exam papers for writing. If you do not know, then you can download it from the official site. There is a sample paper is there. Try to write it down before you go for the exam. Just check your handwriting and everything. What they say is you can expect in a line you can expect 10 words to write. If you have a normal handwriting, then they expect to write you 16 to 20 lines in a full paper from front and back. That is like 16 to 20 means 16 multiplied by 10 is like 160 to 200 words. That's all the relevant data they will say. They will never say you cannot go to 230 words or 240 words, but at the same time they say if you select the relevant data, your letter will be concluded in 180 to 200 words. Even including me, when I started with my letter writing, I was like going to 250, 260, 280. Then it was very difficult for me to conclude because I was writing, like, for example, it says um, she does not have any dietary what do you say, any dietary special dietary requirements. But still I was writing in the letter, please note she does not have any dietary requirements. There is no need of writing like this. Or on examination the heading, and it says no abnormalities noted, and I was still writing on examination no he has no abnormalities, his vital signs were normal. So no need to write all these things. Do not write to write. Select the relevant thing and write accordingly. And I hope that's clear for everyone. Anyone else want to ask anything? Lino says thank you. I hope that's clear for everyone. Anything else? മലയാളികളാണോ എല്ലാം ഉള്ളത്? മലയാളത്തിൽ സംസാരിക്കണോ? ചോദിച്ചോളൂ കേട്ടോ. എന്തെങ്കിലും ഡൗട്ട്സ് ഉണ്ടെങ്കിൽ ചോദിച്ചോളൂ. നമുക്ക് ഇപ്പൊ തന്നെ കൈയോടെ ക്ലിയർ ചെയ്യാം. I'm saying if anyone have any doubts, let's clear and go. Any doubts? Anyone? ആർക്കെങ്കിലും എന്തെങ്കിലും അറിയാനുണ്ടോ? അടുത്ത ക്ലാസ്സിൽ നമുക്ക് റൈറ്റിംഗിന്റെ റിലവൻസി എങ്ങനെ സെലക്ട് ചെയ്യുന്ന സ്പീക്കിംഗ് ക്ലാസ് ചെയ്യുമ്പോൾ നമുക്ക് ജസ്റ്റ് ഒന്ന് ചെറുതായിട്ടൊന്ന് ഡിസ്കസ് ചെയ്യാം. അതേപോലെ സ്പീക്കിങ്ങിന്റെ കുറച്ച് ഈ റിക്കവറബിൾ, കുറെ പേർക്കൊക്കെ ഒത്തിരി അറിയില്ലാത്ത കുറെ കാര്യങ്ങളൊക്കെ ഉണ്ട്. അപ്പൊ അങ്ങനത്തെ കുറച്ച് കാര്യങ്ങളൊക്കെ ചിലപ്പോൾ എല്ലാവർക്കും അറിയാവുന്ന കാര്യങ്ങളായിക്കോട്ടോ. എന്റെ കൺസെപ്റ്റ് ആയിരിക്കും നിങ്ങൾക്ക് അറിയത്തില്ല എന്ന്. പക്ഷെ നമുക്ക് കുറച്ച് കാര്യങ്ങളൊക്കെ ഡിസ്കസ് ചെയ്യാം. കാരണം ഇത് നമുക്കൊരു ഫ്രീ പ്ലാറ്റ്ഫോം അല്ലേ. ഇതിനകത്ത് നിങ്ങൾ എനിക്ക് പേ ഒന്നും ചെയ്യണ്ടല്ലോ. നമുക്കത് സമയമുള്ള അനുസരിച്ച് ഡിസ്കസ് ചെയ്യാം. And we will be continue to live on every Saturday like we had previously. What we are doing is basically നമുക്കിപ്പോ if you can follow all the tasks whatever we have discussed here, you can see previous exam questions ആണ് നമ്മൾ അതൊരു specifically ഒരു pattern ആക്കിയിട്ട് നമ്മൾ ആ ഒരു it won't be that 100% it was like this on the exam, but it let's say like I tried to make it at least 75 to 80% like that, because I collect details. കാരണം നമ്മൾ നമ്മുടെ എക്സാം എഴുതിയ സ്റ്റുഡൻസിനോട് നമ്മൾ ചോദിക്കും എന്തായിരുന്നു നിങ്ങളുടെ ടാസ്ക്, അപ്പൊ അവർ നമുക്ക് പറഞ്ഞു തരും. കുറെ പേര് പറഞ്ഞു സാറേ ഇതിനകത്ത് സ്വോളൻ ഫേസ് അസസ്മെന്റ് ഓൾറെഡി കഴിഞ്ഞതായിരുന്നു, കുറെ പേര് പറഞ്ഞു ഇല്ല ഫസ്റ്റ് ടൈം വന്ന് കയറിയുള്ളൂ അതുകൊണ്ട് മൊത്തം ഡീറ്റെയിൽസ് വേണമായിരുന്നു. അത് പക്ഷെ നമ്മൾ ഓരോരുത്തരും ടാസ്ക് മനസ്സിലാക്കുന്ന രീതിയാണ്. അപ്പൊ ഞാനൊരു 16-17 പേരോട് ചോദിച്ചപ്പോൾ ഏകദേശം 12 പേരും എന്നോട് പറഞ്ഞു അസസ്മെന്റ് കംപ്ലീറ്റ് ആയിരുന്നു എന്ന്. The assessment was complete. So that's why I also decided to make the task as a assessment completed task or examination completed. So that can be started with the name. By thereby you can save another 30 or 20 seconds by you can ask, by asking the name, how can I address you, how can I help you. So അതൊക്കെ നമ്മുടെ ഈ വലിയ വലിയ കാരണം all the recent exam tasks they know they having more than 5 to 6 subtasks. In that also additional subtasks. So it's not that easy anymore. So I hope we need to be precise and speak in short, because a lot of them have it when they see an interesting topic or a topic which they have more knowledge. Some of them have a habit of speaking on and on and on. Let's say like there is a task about asthma, and for example I like what is asthma, then I say like let me explain you what is asthma. Asthma is the narrowing of the what is it, a narrowing of the airways, and in that case there will be because of the narrowing mucus will be there will be more mucus deposited, all these things. So you say go and on. Meanwhile it says only explain asthma and what are the causes of asthma, and it is says narrowing of the airway and causes can be environmental or congenital. But you forgot about this and you spoke about a lot of things you know for 3 minutes, and by the time you come back to the task your time was out. So please be careful, stick to what it is and speak accordingly. And that's it. Anyone want to ask anything more? Anything else? If nothing, thank you guys for joining. Next time when you join, please bring your friends also. Okay, please tell your friends that there is something available here. If you find it valuable, always. If it is useful only. If you don't find it as useful, then we cannot force anyone. So അപ്പോൾ അടുത്ത പ്രാവശ്യം നിങ്ങൾ ഇത് ലൈവിന് വരുമ്പോൾ നിങ്ങളുടെ ഫ്രണ്ട്സിനെ കൂടി കൊണ്ടുവരാൻ ശ്രമിക്കുക. എനിക്ക് തോന്നുന്നു യൂസ്ഫുൾ ആയിട്ടുള്ള ഡിസ്കഷൻസ് തന്നെയാണ്, നമ്മൾ ഹെൽത്തി ആയിട്ടുള്ള ഡിസ്കഷൻസ് തന്നെയാണ് നമ്മൾ ചെയ്യുന്നത്. അപ്പോൾ നിങ്ങൾക്കും അത് എല്ലാവർക്കും ക്ലിയർ ആവുന്നുണ്ട് എന്ന് എനിക്ക് തോന്നുന്നു. ആൻഡ് ഡെഫിനറ്റ്ലി നമ്മുടെ സ്റ്റുഡൻസിന് അത് ക്ലിയർ ആണ്, കാരണം അവരുടെ റിസൾട്ട് അത് അങ്ങനെ വരുന്നുണ്ട്. അപ്പോൾ നമ്മളും ഹാപ്പിയാണ്. ദെൻ നമ്മൾ തുടങ്ങിയപ്പോൾ എന്തായാലും ഒരു ഫ്യൂ മന്ത്സിനകത്ത് ക്ലോസ് ചെയ്യാന്നുള്ള ഒരു പ്ലാനിലാണ് ഇരുന്നിരുന്നത്. ഇപ്പോഴും ഏകദേശം അങ്ങനെ ഒരു പ്ലാനിലൊക്കെ തന്നെയാണ് ഇരിക്കുന്നത്. ഒരു ഇനിയിപ്പോ ഒരു ഡീവിയേഷൻ ഓഫ് മൈൻഡ് ഉണ്ടോ എന്ന് ചോദിച്ചാൽ ചെറുതായിട്ട് തോന്നുന്നുണ്ട്, കണ്ടിന്യൂ ചെയ്യണമോ എന്നുള്ളത്. അതൊക്കെ നിങ്ങളുടെ സപ്പോർട്ടും കാര്യങ്ങളൊക്കെ പോലെ ഇരിക്കും. Then anything else? Anyone? ആർക്കെങ്കിലും എന്തെങ്കിലും ചോദിക്കാനുണ്ടോ? Anyone want to ask anything? Any more doubts? Any doubts? I hope that's it, and let's wind up the section. Thank you guys for joining. Thank you, and I wish all the best to everyone. Let everyone dreams may come true. Thank you.